Welcome to another episode of the Silk and Steel podcast. I'm your host, Carl Zha. Actually, I should say hello and Happy New Year. It is now January 2nd, 2021 on Bali, and it's already January 1st in other parts of the world. I would like to welcome back to our show a returning guest, a very popular guest, Mr. T. Welcome back to the show.
Hey, good to be on here again, Carl, and thanks so much for having me again.
Yeah, it's been a couple months since we talked, and I must say, you are one of the most popular guests on the show. There's always something exciting to talk about whenever you are on, and today we're gonna talk about two topics. So one is the cover up of the COVID response in Washington. We kind of briefly talk about this in terms of Trump's national security advisor, Matt Pottinger's role in our second podcast together. But there's some new details that just emerged that I know you would like to talk about. And for the second half of our show, we would like to talk about another related issue, which is the incoming Biden administration's China policy. Let's talk about the prospect and the outlooks. Shall we just dive into the COVID cover-up story?
Let's do it. Let's do it.
Yeah, maybe you can give our audience, for people who haven't listened to our second episode together, about kind of nefarious role Matt Pottinger play criminally mishandling the U.S. COVID response. Can you just give a brief outline of what we talked about previously, and then we'll just go right into it?
Matt Pottinger and Robert O'Brien, Matt Pottinger is the Deputy National Security Advisor today, and what that basically means is he's the number two on the National Security Council, which is like a White House organization, institution that's a part of U.S. government since 1947, and it's basically a policy planning committee. And Matt's the number two there. He has a focus on China, and he's a noted China hawk, very, very hawkish. He was punched in the face by while he was a reporter for the Wall Street Journal many years ago. He actually was punched in the face by Chinese state security agents while he was attempting to stalk basically an Iranian delegation and a Chinese delegation as they made their way around Beijing, trying to negotiate a military deal. So basically, he's like I don't know if he's confirmed like to be an intelligence agent himself, but he's definitely somebody who orbits in that area. And later on, he went into Afghanistan, where he was involved in military intelligence, and then he went into the White House NSC, first as the Asia specialist and later as the number two.
Pottinger's whole career, starting from reporting as a reporter for Wall Street Journal, and then working the Army intelligence in Afghanistan, and then national security advisor to the White House. It seems like he was groomed almost. Like his career path is just like what's the other guy? Pete Buttigieg, right? I mean, has no background in military. He joined he joined the Marines, right? Now, yeah, he joined the Marines from being a Wall Street Journal reporter. Then he was he co-authored some intelligence paper with then General Flynn, right?
Yeah, so he was just an O3. He was just a captain in a G2 capacity, in a military intelligence capacity, and he was publishing papers with a general, which is actually very atypical for like the military. It's like very atypical for somebody to reach down like 6 ranks basically, or like 5 rank levels, and like grab someone to like go and like co-publish stuff with him. But that's essentially what Pottinger did, or Flynn did. I'm sorry.
And I also heard, among the China watcher circles, that Pottinger is known for being a bit of a zealot, right? Like he's a super China hawk, and
Yeah, there have been like, so I first heard about Pottinger in, call it like Obama 1, so the first Obama term. And I heard about him in China from somebody else who's also plugged into the kind of like China. You could think of him as like a China watcher, and that guy basically called Pottinger like a sanctimonious asshole. And this was before like Matt had any role in policy. This was just based on Matt's uh, what many people in the China expat circle knew about Matt, and knew of him during his time as a reporter for the Wall Street Journal. So he's been orbiting around that circle for a while, and his reputation is pretty precedes him, so to speak.
It seems like his whole, well, other than his stint in Afghanistan, his whole career is very China centered, right? And then like when he finally made his way into the White House, he basically led the kind of the anti-China crusade in from Washington, so much so that he when the COVID first broke out, reported in China, instead of taking measures to do some preventive measures in the United States, he turned that into like an anti-China crusade, right? Like some kind of
Well, I would caveat that, right? Now people who defend him, and there's a long article out there now that defends him quite heavily called "The Plague Year." People who defend him will say that he proposed a travel ban from China, right? Like the February 1st travel ban, and that was like his doing, and that was his effort. But I would say that most people thought and now we realize with the benefit of hindsight, but even most people then, including his own brother, who's actually an infectious diseases specialist at the University of Washington, and that's significant for other reasons. We'll get to that later. But his own brother, who's a specialist in this field, thought that was a bad idea and told him at that time that it would not be that effective. But Pottinger just latched on to that idea anyways, and just it was his baby. He pushed it all the way through, and then and he tries using that as like saying like, look at me. I was like early on the COVID thing, like well before anyone else thought it was a problem. Like I was on it, and it misses the fact that he basically biased the whole policymaking apparatus away from mass test and trace, presuming that his ban was so airtight and waterproof that it would protect the United States for many, many, many weeks longer than it actually did. And now, with the benefit of hindsight, with like serologic testing, we actually know that the U.S. had COVID as early as mid-December of 2019. So we know that like his ban was like bolting together the barn door like 2 months after the horse had already escaped. It was like basically useless.
Actually, I read the article you mentioned, the Plague Year, which is getting a lot of play. At least on social media, I see a lot of retweets on Twitter. When I read it, it seems like it's a piece that Matt Pottinger himself commissioned to cover his own ass in this whole fiasco.
It is the most like it's about as realistic as the score in a round. Like actually, I'll use two analogies to describe this. Right, first, like it reminded me of the score in a round of golf with Kim Jong Il. Right, like Kim Jong Il plays a round of golf. Everybody says like, oh yeah, it's a hole in one. It's a hole in one. It's a hole in one. And that's kind of what this article reminded me of, except replace Kim Jong Il with Matt Pottinger. And the second one is that like how much Pottinger is mentioned inside this article. There are 57 mentions of the word Pottinger in this article. And there's actually only 27 mentions of like Fauci, like the Fauci and Dr. Fauci. Like for an article that's about the plague year and supposed to be an overview of like America's COVID response, it's kind of bizarre that's like the ratio, right? It really kind of shows you who's basically commissioned this piece.
Okay, so maybe first we should start by actually talking about what Matt Pottinger actually did when he was leading the COVID response team from White House, and then we'll talk about his cover-up attempt.
Yeah. So what did Matt Pottinger do? And it's great, by the way, that the Plague Year article came out in one respect, which is that a lot of the things that you and I talked about on the last show about Pottinger, sort of coordinating things, but which were just hinted at, have now been laid out in the open in a fairly like clear way, right? So both the Plague Year article and other articles have indicated that Matt Pottinger and Robert O'Brien ran America's initial COVID response from mid-January to at least January 31st. And then between January 31st and February 25th, Matt Pottinger chaired the interagency COVID task force, even though Health Secretary Alex Azar was essentially the titular figurehead on that committee. Matt Pottinger was actually the person chairing all the meetings. So he was basically the man behind the curtain running things. So this in and of itself is pretty damning because basically Matt Pottinger failed. For lack of a better term, he fucked up. He let COVID spread out of control in the United States. His strategy was ineffective. And if he had just simply done what the Obama administration told him to do and left him to do in their pandemic playbook, he possibly could have saved up to 300 to 350,000 American lives. And that is because South Korea did what the Obama administration did. And South Korea has about 18, maybe 20 deaths per million from COVID. The US has about 1,000 deaths per million from COVID. So literally 98% of America's COVID outbreak could have been eliminated if Matt Pottinger had simply decided to ditch his moral zealotry on China, stop just using COVID as an opportunity to sell a travel ban and like drive a wedge between US and China.
I must interrupt you for a second. According to Matt Pottinger himself, and his leak to the Washington press, it was all China's fault because obviously China was withholding information in the crucial early days.
If it was China's fault, how did South Korea and like Germany and a whole bunch of other countries do better than the US?
But China was withholding all this information, and they criminally mishandled the COVID response so bad that U.S. was just scrambling to catch up because we didn't. China, for example, they didn't weren't forthright with WHO about the infectious nature of the human to human transmission of COVID. So that's why U.S. was caught off guard. I mean, that's a narrative that was being pushed in the U.S. media since April, basically till now. You will still read articles with headline, from New York Times about how the early China fucked up the early COVID response, even in December, right?
That I think that article is like deeply uncharitable, and we'll get to the reasons around that later. But But Pottinger has been pushing that narrative mainly to draw attention away from his own failings, A, and then B, China, compared to how Pottinger did it, like China's response was like infinitely more effective, and they were flying blind. Like, let's not forget that when China was dealing with COVID, people didn't even know what the R naught, like the infectivity ratio, or people did not know what the incubation period of the virus was. And if you don't have those two pieces of data, you actually cannot model how the virus responds to things like lockdowns or things like mask wearing or things like social distancing. You just kind of have to guess.
But Matt Pottinger, who is in charge of the COVID early response task force, I mean, he doesn't have the background in microbiology or virology, right?
Which is like problem number one, which is like, why do you put like a national security specialist in charge of something that requires that kind of expertise?
Oh, that's a fair point, but we know Trump administration is fairly dysfunctional, right? Surely it's not the fault of Pottinger to be put in that position when he doesn't necessarily have the...
No, he wasn't put in that position. He volunteered for it.
Oh.
So one of the articles that like I've returned to again and again is that in January 2020, Robert O'Brien, Pottinger's boss, the national NSA advisor, and then Pottinger himself, volunteered for leading the White House pandemic response because they understood this was the NSC's moment to repair its damaged reputation from what John Bolton had done to it, right? So this was like, they were like, oh, John Bolton, this was right after John Bolton left as the NSC advisor. So they're like, the new guy comes in, kind of wants, specifically O'Brien, he wants to do a good job. He asks Pottinger, what can we do that would be like, an easy win for us, right? And Pottinger's like, let's go like just do a whole bunch of national security stuff around COVID, because we're pretty sure COVID is going to mess up China pretty badly. Let's put a big travel ban around China. Let's and then let's do like all that stuff, and it'll be an easy win for us. And that was literally how they got started.
And also, didn't Pottinger also coin the phrase Wuhan virus and put?
He did.
Yeah,
he did. So by the way, that was like many months later. That was in March. So after Pottinger knows he's totally screwed the pooch, there are some things going on that between the U.S. and China that he wanted to disrupt. He decides to coin the term Wuhan virus and get Trump to push it out in order to A, shift the blame back onto China for his own failings, and then B, also make sure that China and the U.S. could like to throw sand in the gears on cooperation between China and the U.S. in tackling the pandemic.
Okay, but let's go back to the late January, early February when Pottinger is in charge. I mean, did he have all the information he needed to coordinate a effective COVID response?
In late January, likely no, because in late January China didn't either.
Right.
Well, no one actually no one had the R0 in incubation period for COVID was not really well established in China itself.
Well, China did lock down Wuhan in January.
They locked down Wuhan basically when there was still a considerable degree of uncertainty in the data. Yes, they were making a data-driven decision. It was, and this is based on. I know some people who are in the Chinese healthcare system and who are also second degree connections of people in China CDC, and they'll just say that like, look, in late January, like China really did not have there was no statistically significant estimate of R0, for example, in late January.
But they just made a call to lock down Wuhan just in case, right?
Yeah, just in case. It was like a just in case, like shit, let's just lock it down, right?
Okay. But okay, then there's an argument that the West in the Western democracy, we cannot do that. We cannot do what China did because we
which is fine. I mean, like South Korea did something that never locked down. South Korea just did mass test and trace, and they were still able to have a COVID outbreak that was like 1/50th the size of, relative to the population, the size of the outbreak in the U.S.
And you mentioned that South Korea actually use a pandemic response kit
plan
outline that was first put out by U.S. CDC, right?
Yep. In 2014, Obama's CDC worked with South Korea's CDC to put together a pandemic basically like a SARS-2 respiratory response, like illness response plan. And South Korea followed that plan, and it involved mass test and trace. It involved trying to do social distancing, so like shutting down like between tables and restaurants. It involved like screening inbound travelers, encouraging like home quarantines for inbound travelers, that sort of thing. And they were able to like have like a 1/50th, like literally an outbreak that was like 2% of the U.S. outbreak.
Now, so is it just a matter of U.S. official getting caught off guard because they just didn't foresee?
No, I think that it was literally it was hubris and incompetence. It was equal parts hubris and incompetence. And I'll like lay this case out in three ways. First, basically, the Plague-Year article states that the real, like, one of the moments the U.S. could have fixed, like the reason the U.S. couldn't have done what South Korea did is because the U.S. had a flaw in manufacturing mass numbers of test kits. Except that was actually a known problem. That was not an unknown problem. Pottinger in the article says, oh yeah, I just found out like that, the CDC's test kit manufacturing facility is like a microbrewery. It's not like Anheuser-Busch. It's not going to make huge amounts of test kits. Well, that was actually known. That should have been known to Pottinger when he volunteered for the job of managing COVID back in mid-January. It shouldn't have been something that he found out like a month later, right? Like that's like actually like that's like for somebody, and this is, I will criticize him from the perspective of like an intelligence analyst, right? You're a military intelligence guy. You possibly were former CIA. You should be good at like correlating means and ends. Like that's your job, right? And like correlating capabilities and like methods and that sort of stuff. And for you to like miss that basic point in your strategic planning process, like demonstrates like just incompetence. You're just bad at your job.
Personal anecdote. I just add a little bit personal family story into this. My sister, my niece, came down with sickness after my sister hosted Super Bowl party. So early February, and by mid February, my niece was very sick, and my sister got my niece to the hospital. She got negative test result for flu. So my sister started panicking and she wanted to test my niece for COVID. But she ran into all the bureaucratic hurdles, hitting her head on every red tape just to get my niece tested. And in the end, they told her no. First she went to the hospital. Hospital says we don't do the test. You have to contact the government health department. She contacted state health department. They say go to county health department. So and the county health department finally told her, like, we will not test your daughter because she does not qualify for the criteria laid out for the CDC. A, she did not have a recent travel history to Wuhan. B, she needs to come in contact with a known case of COVID patient. And now we know the reason my niece couldn't get tested in mid-February is because CDC has all these faulty test kits. They don't have enough. So that's why they kept to address this issue. They made a very stringent guideline so to make sure people are not getting tested.
Oh, yeah. So your niece's experience there was actually symptomatic of a broader U.S. imposed restriction on testing during that time frame. And it was because the CDC and Department of Health and Human Services, acting on recommendations from the task force itself, barred non-CDC entities from conducting tests until February 25th in the United States. So when was this for your niece? Was this early Feb?
It's February 16th.
Yep.
February 16th.
Yep. That fits the timeline. And by the way, Pottinger could not have not known, by the way, that the U.S. could have, like the tragedy is the U.S. had the capacity to start doing testing from using other test kits from both sources in the US and in China and from China, and imported tests from China and imported tests from South Korea, by the way, in early February. Somehow the US rejected all of those things. And since Pottinger was coordinating the task force meetings, buck stops with him on that decision. Pottinger could not have not known that fact for two reasons. First, Paul Pottinger, which is Matt's brother, works at the University of Washington infectious diseases lab, or he works at the Division of Allergy and Infectious Diseases under the UW Department of Medicine. You know who else works there is a lady by the name of Helen True. So same department, also a specialist on infectious diseases. And before you sit, and the two of them know each other. Obviously the infectious diseases department is big. You can say, oh, there's 100 some odd professors in there. How can they all know each other? Well, Paul and Helen True have actually collaborated on scientific papers together. They've collaborated on scientific papers that they've actually worked together on a scientific paper that actually is called, I think it's PCR-based influenza monitoring. So basically they were using, it's about using tests to monitor the spread of a flu virus. Literally, Paul Pottinger has to have known that Helen has this, his fellow colleague in this department has this capacity to go and do it and knows a lot about virus testing. Well, Helen at the time was actually asking anybody she could repurpose her PCR testing kit to go and test for COVID. And we all know that Seattle was one of the initial hotspots for the U.S. And the U.S. could have just started doing mass test and trace there if they had just, heeded Helen's advice and just let her do her thing. But somehow she was stymied. She couldn't get an emergency use authorization from the FDA. She couldn't, the CDC kept blocking her, blah, 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 blah. And I think the chance is basically zero that Matt did not know that this capability existed, because, Helen and Paul know each other. And Paul was talking to Matt as his brother, serving as a source of advice on a topic that Matt knew nothing about. And Matt was running the interagency task force.
Now I'm going to stop you for a second, Mr. T, because according to the Plague Year article, Paul Pottinger did talk to his brother Matt Pottinger and alerted him of the seriousness in the U.S. unpreparedness. According to the Plague article, Matt Pottinger was very concerned, right? So how do you square that?
So he was concerned, but did Matt Pottinger actually go and fix the problem?
No.
I mean, he basically was the coordinator in the task force. In the whole article, it just basically says, Matt is concerned. That's A. And then B, it also doesn't say when Pottinger actually talked to him about the lack of test kits, right? That was actually after the section titled "The Lost February." You're right that obviously that Matt knew about the problem, and that's also my point as well. But I think it's wrong to say that Matt was actually effective in resolving the problem, and I think that is not just an innocent mistake, because also the second thing is that also this Chinese and South Korean test kits that the U.S. could have gotten back in early Feb, they were rejected as well, and that decision is not sort of a purely healthcare decision. That's a geopolitical and a foreign policy decision, right? And it's especially it's very, very tragic because on February 10th, by the way, it stated that they found out that the CDC made test kits were faulty. So not only could the CDC not manufacture that many kits, the kits themselves were broken. They should have decided on a triage plan, but somehow between February 10th and February 25th. When they finally lifted the ban, they were scrambling around and just shuffling papers around. And at that point, China had already offered test kits. In fact, China first did it on a government-to-government basis, and later on, even people like Ma Yun, like Jack Ma, were talking to the U.S. about offering millions of masks and test kits himself, and that was in early March.
I remember.
So, yeah, you remember that. And South Korea, by the way, was doing the same. And if you can say, oh, by the way, China is an enemy of the United States, you shouldn't take help from them. South Korea is a treaty ally. Okay, they're supposed to be helpful to the U.S. and somehow the U.S. still didn't end up with South Korean kits either. So it's very strange.
Who has authority to reject importation of Chinese and Korean PPE and test kits?
I would surmise it is the NSA Asia or NSC Asia specialist, who happens to be Pottinger's job title. So that's that is what it is.
Can we really blame dysfunction of U.S. political process and political system on one person, on Matt Pottinger himself? I mean, he just one person, one cog in the wheel, right? And he just happened to be at the at the helm.
Wrong place at the wrong time.
Yeah, right.
I mean, he was basically this is the conclusion that to make, actually. It's not, he is a deputy NSA director. So he's somebody with an enormous amount of power and influence over other federal agencies. He had a virologist wife, Yen Pottinger, who by the way, recommended Deborah Birx for her job. So somebody with a lot of influence and pull. An epidemiologist brother. He knew how to speak Chinese. He has China knowledge. And he had a winning pre-written playbook left for him from the last prior presidential administration. He should have beaten COVID one-handed. It should have been like a complete, to use a military analogy, it should have been a one-sided battle. It should have been something like the U.S. invasion of Grenada, right? In terms of one-sidedness. In fact, he managed to fuck up a winning hand, and that's pretty damning.
What happened to Helen Chu's attempt to implement the test trace program that was similar to South Korea's.
So she was not given permission to go and start doing this, and then she just went ahead and started doing it herself in late February. She got tired of waiting, and then that was when the first U.S. community spread cluster was identified, and that was when like the stock market started falling.
And what did Matt Pottinger do during that time?
Well, he started shifting his focus to trying to push a lab leak hypothesis in Wuhan, and then B, starting to try and get Trump to blame the thing on like China and use the term Wuhan virus.
When you say the lab leak hypothesis, it was that conspiracy theory that the COVID was actually a man-made virus leak from a Chinese weapon, a bioweapon lab, right?
Yep. Not a bioweapon lab, like a Chinese, just a virus research lab. It's a lab to research and defend against viruses, not create them. And it's based in Wuhan.
Well, I heard it repeated by U.S. politicians and U.S. senators. They call it.
That's all part of Matt's narrative. That's all part of Matt's narrative. Actually, he was the one who ran around saying that this is bioweapons. So,
I mean that it got a lot of air view. I mean, not just from crazy U.S. politician, but also mainstream media journalists.
Well, this actually goes to this overarching meta point, right? Which is that Matt Pottinger has been driving the narrative on the Trump narrative on COVID. That is actually the thing. And the reason he's been driving a lot of this narrative is because from mid-January onwards, all the meetings of the COVID task force were actually classified. And that decision came from the National Security Council. So it means it came from him, it came from Matt. By classifying all those meetings, it meant that people in it like couldn't leak to the media without potentially being prosecuted. But if you read the Plague-Year article, the whole article is basically Matt Pottinger bitching about anybody who had the misfortune to be in a task force meeting with him. He bitches about Azar. He bitches about Redfield, the CDC director. He even bitches about Dr. Fauci as being too hesitant and data-driven. My God, it's literally, he bitches about the State Department for sending supplies to Wuhan. You know, it's like a never-ending bitch fest, and the only people like who it's like the Pottinger family saga. His wife Yen Pottinger is portrayed as some sort of all-knowing virology hero. His brother Paul, or his wife Yen, is portrayed as a hero. His brother Paul is portrayed as leading the response in Seattle and triaging patients when his name doesn't even show up on Helen Chu's paper that describes how they eventually sequenced all the COVID patients in Seattle. So it's like a complete. And by the way, Helen Chu's name doesn't even show up in this Plague-Year article once,
wow.
right?